I just want to talk about what defines an inpatient rehab, or what is an inpatient rehab. So CMS, or Center for Medicaid and Medicare Services, defines inpatient rehab as a facility that has intensive therapy for patients, and patients must be able to tolerate 3 hours of therapy a day. And so that's one of the biggest things that set apart inpatient rehab from other rehabilitation settings, because patients are required to get that 3 hour time of therapy per day. Usually it's for 5 days a week. Another thing that separates or defines inpatient rehab is that patients are under Medicare type A. So it is an inpatient setting that goes under type A for Medicare. And then patients that go into inpatient rehab are assessed under the IRF-PAI, which is basically the assessment tool that shows patient progress and how they're moving through their plan of care. And I will get into that into later videos, because the IRF-PAI is a whole thing in itself. It encompasses many different aspects of mobility, cognition, bowel and bladder, a lot of other things. And it's a beast to conquer. But that's like the formal definition for inpatient rehab. Inpatient rehab, from what I've seen, it's a lot of times patients are coming into the hospital after experiencing a really significant diagnosis that probably changes their functioning. So it could be a spinal cord injury, it could be a traumatic brain injury, it could be a stroke, it could be a transplant. A lot of people with transplants can do inpatient rehab. It might be someone who is dealing with a cancer diagnosis, or maybe someone who has multiple traumas. And they're going into inpatient rehab, and really the goal is to help return these people to their most effective function possible. It's tolerating 3 hours of therapy a day. So a lot of these people have been higher functioning before, and like as a therapist, my goal is to get them to as close to their prior function as possible so they can go home safely. And a lot of times the goal is for patients to go home, when we like to see when they're able to go home. But so that involves helping someone relearn how to walk, or teaching them how to get from the bed to the wheelchair, or learning how to do stairs again. Or if someone who has a spinal cord injury might not be able to return to walking, it's teaching these patients how to move in a wheelchair effectively, and how to get out of bed, and how to safely move their limbs. And it's not only teaching mobility, but it's also just teaching them new aspects about their diagnoses. There's a whole list of things to be aware of after having a spinal cord injury, or a traumatic brain injury, or a stroke. And it's really educating these patients on what things to watch out for, and what things they can do to keep them safe and functioning properly. But that's a big component of inpatient rehab. There's so many more things that are involved in inpatient rehab, and I look forward to talking more about them.